Hi, it's Dr. Paschke with Heart Health Prevention and Wellness. I'm a cardiologist and I'm here today. We're talking about risk factors for heart disease, and I wanted to talk today about high cholesterol. So everyone's heard of cholesterol, but it's important to discuss because heart disease remains the leading cause of death for men and women. So understanding all these risk factors is an important way that we can reduce our risk of cardiovascular disease. There are some new cholesterol particles to discuss, apoB and Lp(a). The inclusion of apoB and Lp(a) in our understanding of cholesterol helps provide a more detailed picture of cardiovascular risk. So I wanted to talk about those today in addition to LDL and HDL. Cholesterol is a waxy substance that is essential for various bodily functions. It's a part of our cell walls, and it's important in the production of hormones and vitamin D. Cholesterol is transported through the bloodstream by lipoproteins, primarily categorized into low-density lipoprotein, or LDL, and high-density lipoprotein, or HDL. So LDL is known as the bad cholesterol, and you've probably heard of that one. LDL can lead to buildup of plaque in arteries, increasing the risk of heart disease and stroke. And HDL, or the healthy cholesterol, that's the good cholesterol. HDL helps remove cholesterol from the bloodstream and reduces our risk of heart disease. In addition to HDL and LDL, there are some newer particles that have been described to be associated with increased cardiovascular risk, and these are apolipoprotein B and Lp(a). Apolipoprotein B, or apoB, is a protein found in particles that carry cholesterol through the bloodstream, include LDL, VLDL, and IDL. So those are different subparticles of cholesterol, and higher levels of apoB indicate a greater number of these particles, which again can lead to plaque formation and arterial blockage, increasing the risk of cardiovascular disease. Lp(a) is a particle similar to LDL cholesterol, but includes a protein that makes it more likely to cause atherosclerosis and to promote clot formation. High levels of Lp(a) have been associated with increased risk of atherosclerosis, heart attacks, and strokes. Lp(a) is mostly transmitted. Your propensity to have a high Lp(a) is usually genetic, and it's not affected as much by some of the other cholesterol medications that we use. So it's important to modify your other risk factors to help sort of offset risk of elevated Lp(a). So the interplay of HDL, LDL, apoB, and Lp(a) levels significantly influence cardiovascular disease risk. Elevated levels of LDL and apoB contribute to buildup of plaque in arteries, and high levels of Lp(a) increase the risk of clot formation. And conversely, high levels of HDL are protective. So what can we do? Managing cholesterol levels and reducing heart disease risk involves comprehensive lifestyle and dietary adjustments and medications when needed. So regular exercise, maintaining a healthy weight, consuming a mostly whole food plant-based diet, rich in fruits and vegetables, whole grains, and lean protein are foundational. We should reduce our intake of saturated fats, which are found in red meat and full dairy products, and trans fats, which are often found in processed and fried foods. And we should also be aware of our numbers. So just like we should be aware of our weight and our blood pressure numbers, you should also know your cholesterol numbers. European guidelines recommend that everyone have a Lp(a) level checked at least once in their lifetime. That's not included in the U.S. guidelines yet, but is likely coming. But you might ask your doctor to check your apoB and Lp(a) levels, because again, it can guide your doctor in assessing your risk. And then beyond lifestyle modification, sometimes people's levels are still high even after they try those things. Sometimes we need to use medications to lower your cholesterol levels. Statins are the ones that most people have heard of. They've been around forever, and they are effective in lowering cholesterol levels. There are some newer drugs, some injectable drugs, so it's best to talk to your doctor about that if it's time for medications. So the expanded understanding of cholesterol types, including apoB and Lp(a), provides deeper understanding into cardiovascular risk factors and can enhance strategies for preventing and managing heart disease. By adopting a comprehensive approach that includes lifestyle modification, dietary changes, and medical interventions, people can significantly lower their risk of heart disease, paving the way to a healthier life. So join me next week as we talk about another risk factor for heart disease, which is diabetes.